Hello and welcome to our segment. I'm Damien Qatar.
I'm Adrian Bazuni.
And I'm Genesis Evangelista. In today's media release, we will be discussing a very important topic that affects many Australians. But the main social group affected by this are the Aboriginal people in Australia. This is the health inequality that is coronary artery disease. Coronary artery disease is a serious health issue that is becoming more and more common in Australians. This is due to many factors and social inequalities such as heredity, poor lifestyle choices, and race. People with an Indigenous background or live within the ATSI community have a greater risk of getting this health inequality. Coronary artery disease can also lead to poor health outcomes. Coronary artery disease occurs when your coronary arteries get narrower and reduce the blood flow to your heart. Coronary arteries are like small pipes that supply blood to your heart. They get narrower when fatty material, such as plaque, gradually builds up inside and clogs them, causing atherosclerosis. If you have had a heart attack due to plaque buildup in arteries, then you have coronary artery disease. While there are no cures for coronary heart disease, there are treatments and lifestyle.
Thank you, Professor Jens, for your valuable input. Now to a break. But stay tuned because in 15 minutes I'll tell you how health inequalities can contribute to poor health outcomes. Health inequality means that some people die younger or have a poorer health based on where they live, their genetics, their job, or how much money one earns. Health inequalities is the health status or in the distribution of health determinants between different population groups. For example, differences in mobility between elderly people and younger people, or differences in mortality rates between people from different social classes. These health inequalities contribute to poor health outcomes, as one can unfortunately be diagnosed with a disease which can be caused by genetics. For example, if breast cancer is common in your family down the generations, yourself has a high chance of being diagnosed with the disease. Also, living in a country that presents a high risk of a particular disease can contribute to the poor health outcomes of yourself. Next, Adrian will be sitting down with a heart surgeon from the Westmead Private Hospital in a one-on-one interview. Don't miss it.
So what are the main groups that are affected by coronary artery disease and why?
Generally speaking, the elderly, because many CVD are aging, calcification, atherosclerosis disease that has built up over time and consequences of lifestyle, and low socioeconomic groups because of lifestyle. Also the Indigenous population, geographically isolated people are also at risk, and it can vary from location, whether you're in rural areas, which gives you limitations. Patients with private health cover are able to receive certain procedures earlier than those who are on the public system. Adherence to medications, as it can be costly, as coronary artery disease, individuals take up to 5 tablets, which are pretty pricey for those on pension and also low income earners. Those who are lower socioeconomic statuses tend to be smokers and obese, which are main risk factors for the disease.
How do you reduce the likelihood of developing coronary artery disease?
So there's non-modifiable risk factors, of course, things like being a male, having a family history, or premature coronary artery disease, which are for people under the age of 55. But the ones we can control, which are modifiable, are smoking, weight, people who are obese, also having diabetes or glucose intolerance, also exercise or lack of it.
Has any treatments been discovered for coronary artery disease and what are they?
Yeah, so there's been a range of treatments that have been discovered over the past couple of years. Things like risk factor reduction, weight loss, exercise programs, dietary medication for lipid lowering medication, smoking cessation, and good glycemic control for diabetics.
What message do you have for Australians to avoid coronary artery disease and chronic disease?
Okay, so the biggest message I have for people in Australia is seek medical advice early and have a good relationship with your GP. If you feel any chest pains at all, don't delay going to the hospital. Go as soon as you can.
Thank you for spending your time to answer these questions, Doctor. Now back to Damien in the studio.
Thank you, Adrian. And a big thank you to the heart surgeon from the Westmead Private Hospital coming in and talking to us about a deep issue. That sadly brings an end to our segment. It was a pleasure discussing the issue coronary heart disease within Indigenous communities with you today. Until next time.